Have you ever found yourself stuck in a loop, checking something over and over again? These repetitive actions might seem harmless, but for some, they are indicative of a deeper issue known as Obsessive-Compulsive Disorder, or OCD for short. OCD is a common, chronic, and long-lasting disorder that is characterized by two main components: obsessions and compulsions. Let's break these down a bit. Obsessions are unwanted, intrusive thoughts, images, or urges that trigger intensely distressing feelings. Picture having an alarm constantly going off in your head, telling you something's not right, something's not safe. That's what obsessions can feel like. Now, let's talk about the second part: compulsions. These are behaviors an individual engages in to attempt to get rid of the obsessions and reduce distress. It's like having an itch that you just have to scratch. But in the case of OCD, this itch isn't relieved by a quick scratch, but rather it demands a specific ritual to be performed over and over again, like checking the stove multiple times before you can leave the house or washing your hands until they're raw. The real catch here is that people with OCD understand that their thoughts and behaviors are not rational, but they feel powerless to stop them. It's important to note that OCD is not a sign of personal weakness or a character flaw. It's a neurobiological disorder that affects people of all ages, races, and backgrounds. OCD can be disruptive and time-consuming, often causing significant distress and interfering with daily life. But the good news is, it's treatable. With the right help and support, people with OCD can lead fulfilling lives, free from the chains of their obsessions and compulsions. So why are we talking about this? Because understanding is the first step towards compassion and support. By learning about OCD, we can help to reduce the stigma and misconceptions surrounding this disorder, making it easier for those affected to seek the help they need. Now that we understand what OCD is, let's delve deeper into the signs and symptoms. Do you know what signs to look out for when it comes to OCD? Let's delve into the world of obsessive-compulsive disorder, commonly known as OCD, and identify some of its key signs and symptoms. They typically fall into two categories: obsessions and compulsions. First, let's discuss obsessions. These are recurrent, persistent, and intrusive thoughts, impulses, or images that cause distress or anxiety. They're not simply excessive worries about real-life problems, but rather, they're often irrational or exaggerated fears. One of the most common obsessions in OCD is an excessive fear of germs or contamination. Imagine being constantly plagued by the thought that everything you touch is teeming with bacteria, despite knowing it's not logical. It's like having a broken alarm system in your brain that's constantly on high alert. Another type of obsession includes unwanted, forbidden, or taboo thoughts. These can involve themes of harm, religion, or sexuality and can be quite distressing to the individual. They're thoughts that seem to pop up out of nowhere and feel completely out of character. A further obsession that some with OCD may experience is an intense need for things to be symmetrical or in a perfect order. Picture feeling an overwhelming sense of unease if objects on your desk aren't aligned just right, or if a picture frame is slightly askew. Now, let's move on to compulsions. These are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession. They're meant to prevent or reduce anxiety or distress, or prevent a dreaded event or situation. However, they are not connected in a realistic way with what they are designed to neutralize or prevent, or they are clearly excessive. A common compulsion in OCD is excessive cleaning or hand washing. This is often in response to fears about germs or contamination. It's not just about washing your hands after touching something dirty, but rather it could mean washing your hands until they're raw and chapped, even if you've not touched anything considered dirty. Ordering and arranging things in a particular precise way is another compulsion that many with OCD experience. This isn't just about liking things neat and tidy, but rather it's a need for things to be positioned in a very specific way, and any deviation from this can cause significant anxiety. Lastly, repeatedly checking on things, such as whether the door is locked or the stove is off, is a common compulsion. This isn't just double-checking. It's a need to check over and over again, even when you know that you've already checked. Understanding these signs and symptoms is crucial in recognizing OCD in ourselves or others. It's important to remember that everyone's experience with OCD is different. What might be a symptom for one person might not be for another. Knowing the signs and symptoms is the first step, but what can we do about it? If you or someone you know is showing signs of obsessive-compulsive disorder, don't worry, there are ways to manage it. Living with OCD can be challenging, but it's crucial to remember that it's not a life sentence. A variety of treatments are available that can help manage the symptoms and improve the quality of life. Let's delve into some of the most common ones. Cognitive behavioral therapy, often abbreviated as CBT, is a type of psychotherapy that can be incredibly effective for OCD. CBT is all about changing patterns of thinking or behavior that are behind people's difficulties. It focuses on the here and now problems and difficulties, instead of focusing on the causes of your distress or symptoms in the past. This therapy encourages you to face your fear and let the obsessive thoughts occur without putting them right or neutralizing them with compulsions. Another effective technique is exposure and response prevention, or ERP. This form of CBT involves gradually exposing you to your fears or obsessions and teaching you healthy ways to cope with the anxiety this causes. The exposure part of ERP involves direct or indirect contact with the fears and thoughts that make you anxious. Over time, this exposure helps reduce the intense anxiety that these thoughts can cause. While ERP can be challenging, it's often very effective. With practice and perseverance, you'll likely find your OCD symptoms decrease over time. Remember, it's not about getting rid of the thoughts, but changing your reaction to them. Medication can also play a crucial role in managing OCD. Certain types of medicines, particularly a type of antidepressant called selective serotonin reuptake inhibitors, SSRIs, have been found to be beneficial in reducing OCD symptoms. These medications increase the concentration of serotonin in the brain, which helps regulate mood. It's important to note, however, that medication works best when combined with psychotherapy. Finally, remember that it's perfectly okay to seek professional help. Mental health professionals like psychologists and psychiatrists are equipped with the knowledge and tools to help you navigate your way through OCD. They can guide you through the process of CBT or ERP, prescribe medication if necessary, and provide a supportive environment for you to express your thoughts and feelings. It's essential to remember that everyone's experience with OCD is unique, and what works for one person might not work for another. The road to recovery can seem long and winding, but with the right treatment and support, it's entirely possible to manage OCD and lead a fulfilling life. Treating OCD is not a one-size-fits-all approach. It's important to find what works best for you. Remember, it's okay to ask for help. You're not alone in this journey. Remember, it's okay to seek help. You're not alone in this. In our journey through life, we sometimes encounter hurdles that seem too high to jump over. When it comes to our mental health, these hurdles often feel even more daunting. But there's a strength in acknowledging these challenges, and an even greater strength in seeking assistance to overcome them. Obsessive-compulsive disorder is one such hurdle. It can be a bewildering experience, filled with doubts, fears, and constant questioning. It's like a loop in your mind that you can't seem to break free from, but it's important to remember that it's not your fault. It's not a sign of weakness or a character flaw. It's a health condition, just like any other, and it deserves attention, understanding, and treatment. In fact, seeking help is an act of courage. It's a step towards reclaiming your life from the grips of OCD. It's a testament to your resilience and your determination to strive for a better, healthier future. So, don't be hesitant to reach out. Talk to a mental health professional, confide in a loved one, join a support group. There are numerous resources and people out there who are ready and willing to help you navigate through this. And remember, it's not just about managing OCD, it's about understanding it. It's about gaining knowledge, dispelling misconceptions, and breaking the stigma surrounding mental health. That's where we come in. If you found this video helpful and want to learn more about various health topics, hit the subscribe button below. Education is the first step towards understanding and managing our health better. By subscribing, you'll be joining a community dedicated to promoting awareness and understanding of health issues. Each video we create is a step towards a more informed, empowered, and healthier you. So let's take this journey together. Let's learn, grow, and overcome, one video at a time.